Assess the patient to determine whether he's unresponsive. Tap him on the shoulder and shout, "Are you all right?" This helps ensure that you don't begin CPR on a conscious person. If the patient is unresponsive, shout for help and activate the emergency response system, if appropriate. Check to see whether the patient is apneic or only gasping, as opposed to breathing regularly. And if you're able, simultaneously check for a pulse to minimize delay in detecting cardiac arrest and initiating CPR. To check for a pulse, palpate the carotid artery that's closest to you by placing your index and middle fingers in the groove between the trachea and the sternocleidomastoid muscle. Open the patient's airway. Use the head tilt chin lift technique unless you suspect a cervical spine injury, in which case, use the jaw thrust maneuver without head extension. Place the patient supine on a firm surface, such as a backboard or the floor. If the patient is on an air-filled mattress, deflate the mattress to maximize the effectiveness of chest compressions. When turning the patient, roll the head and torso as a unit. Avoid twisting or pulling the neck, shoulders, or hips. After administering 30 compressions, open the patient's airway and prepare to give 2 ventilations. If the patient doesn't appear to have a cervical spine injury, use the head tilt chin maneuver to open the airway. To perform this maneuver, first place your hand that's closer to the patient's head on the forehead. Then apply enough pressure to tilt the patient's head back. Next, place the fingertips of your other hand under the bony part of the lower jaw near the chin. Avoid placing your fingertips on the soft tissue under the patient's chin because you may inadvertently obstruct the airway you're trying to open. If you suspect a neck injury, use the jaw thrust maneuver. Rest your thumbs on the patient's lower jaw near the corners of his mouth, pointing your thumbs towards his feet. Place your fingers around his lower jaw, and lift the lower jaw to open the airway. To begin ventilations using a barrier mask with a one-way valve, position the narrow portion of the mask over the patient's nose and the wide portion above the patient's chin. Covering the nose and mouth with the mask, create a tight seal. Take a regular breath, and place your mouth on the mouthpiece. Alternatively, to begin ventilations using mouth-to-mouth rescue breathing, pinch the nostrils shut with the thumb and index finger of the hand you've had on the patient's forehead. Take a regular breath and place your mouth over the patient's mouth, creating a tight seal. Keep in mind that guidelines recommend a handheld resuscitation bag and mask only when a second rescuer arrives. They don't recommend use by a lone rescuer. Give 2 regular breaths each over 1 second, to promote oxygenation and prevent overinflation of the patient's lungs. Each ventilation should have enough volume to produce a minimal chest rise to ensure adequate ventilation.